Hi, everyone. Thanks for joining us this evening. I'm Dr. Sadia Khan. I'm a breast surgeon and I run the breast cancer survivorship program here at Hoag. And we are super excited to have you join us this evening. We have some wonderful talks and some great speakers. So we're hoping to have a fun and informative event. Please keep in mind that we want to try to make, even though we know it's a virtual event and we miss all of the in-person fun, we want to make this as interactive as possible. So please use the chat function to put in any questions that you have, and we'll make sure that all of your questions are answered. And thank you again for joining us. Anybody who registered will get a newsletter with a link to a survey. We would love to hear your thoughts on how you enjoyed our event tonight, or any ideas that you have or topics you'd like to hear about for the future. So thank you again for joining us, and please keep in mind to keep any questions that you have, put them into the box so that we can answer them for you. And we hope you enjoy the event tonight. So our two wonderful speakers, first we'll have Dr. Puangco. Dr. Puangco is, his name is Dr. Jose Puangco, is Chief of Service for Sleep Medicine at the Hoag Voltmer Sleep Center. He has expertise in multiple specialties and created the cognitive behavioral program for insomnia here at Hoag. He's been instrumental in providing complete care to all of our Hoag sleep patients, and has a private practice, private neurology practice set up in Irvine. So thank you tonight for giving us tips on sleep, which is much needed, I'm sure, for a lot of us. And then our second speaker will be Leanne Medrozian. She's a registered dietitian, and she's worked at Hoag Hospital for 22 years. A fun tidbit is that she was actually born at Hoag Hospital, which is pretty awesome. She has areas of expertise that include medical nutritional therapy, behavior modification, and helping patients who are fighting cancer through their journey of diagnosis, treatment, and survivorship. Leanne focuses on translating nutritional science into practical, real-world use. So we're really looking forward to those tips tonight. And she really likes to focus her efforts on improving patients' outcomes and quality of life. So without further ado, Dr. Puangco, I'm going to hand it over to you to give us some great tips. And thank you again for being here tonight.
Thank you. Can you hear me okay?
Yeah, we can
All
hear
right.
you
Great. Thanks for having me on. Good afternoon to everybody. I was asked to give a talk on sleep, and I think it's an important talk for really everybody in general, but also important for patients with breast cancer survivors. I just wanted to just go over just an overview just over breast cancer itself to start it off. Next slide. Breast cancer is the most commonly diagnosed cancer among American women. It accounts for about 25% of all cancers in women, and it's the most common cancer globally as of 2021. So pretty important cancer to discuss, and the sleep relationship to it. In terms of just breast cancer, we always think of breast cancer just in women, but there's also a risk of breast cancer in men as well. A man's lifetime risk of breast cancer is about 1 in 833. Next slide. So in terms of risk factors for breast cancer, there's increased risk with age, especially if one's older, early menarche, or later menopause, or family history of breast cancer, or if there's any type of gene mutation. Next slide. So as far as factors that you can control, exercise is important. That can help maintaining weight in terms of trying to avoid being overweight or obesity. A discussion with your doctor, of course, in regards to hormone replacement therapy after menopause, pregnancy after 30 years old, alcohol consumption, and also sleep. Next slide. So in terms of sleep, I'm talking about really a lack of sleep. And due to a lack of sleep, which is what we call insomnia, it can cause higher levels of pain perception. It can lead to consistent fatigue, which can persist even months, even after treatment with chemoradiation therapy. It can affect concentration, cognition. It can affect productivity during the day, and it could also lead to emotional disorders or augment existing emotional disorders. Next slide. In terms of looking at insomnia, this is what we call the Spielman model of how insomnia envelops. There's premorbid conditions, which is the dark blue. This is kind of our baseline level of insomnia. The predisposing factors of what we're dealt with, the cause we're dealt with in life. There's precipitating factors as far as things that can cause insomnia to worsen. And there's perpetuating factors, which allow the insomnia to persist, even though the precipitating factors have been dealt with. Next slide. So for predisposing factors, as one gets older, insomnia is more common. It's more common in women. There's a family history of insomnia, or if, say, you've had insomnia ever since you're a little kid, or if you have what we call a hyperarousability trait, which is basically one who has more of a sympathetic drive, where they're just more alert, so it's hard for them to get into a deep sleep, or if there's any type of underlying psychiatric disorder. Next slide. Precipitating factors are things that can worsen the insomnia, as I mentioned. So this could be related to the disease state or certain type of tumors, especially those that can increase corticosteroid production. Treatment, of course, surgeries, chemotherapy, radiation therapy, hormonal fluctuations, the symptoms from hormonal fluctuations, such as vasomotor symptoms, the cancer symptoms itself, such as pain, fatigue, confusion, what cancer can bring on, the anxiety and depression, the stress from cancer itself and the treatment, or any type of transplantation. Next slide. Perpetuating factors is what we do to try to compensate for our insomnia, which is if we can't sleep, it's not uncommon. We try to sleep longer, or we try to go to bed earlier, or we might try things that we feel can help us with our sleep, such as maybe some over-the-counter medication, some sleep aids, maybe watching a little TV gets us drowsy and help us sleep. And all of these things can actually make our sleep worse. It can also our attitudes about sleep, meaning that we really don't need sleep, or sleep is not important. And that could further make the insomnia worse as well. Next slide. So my goal for you today is to try to give you some tips to help you with trying to improve your sleep overall. Next slide. So probably one of the most important tips I can give is waking up at the same time each day. So the best way to think about it is that our brain has this countdown timer when we wake up, and it actually counts down to when we're supposed to sleep at night. So if we vary the time that we wake up, we also vary the time that we're going to go to sleep. And that's important because our brain needs this start off point to help keep our sleep consistent and regular. Next slide. So when you do wake up, the important thing is to set your circadian rhythm. So our circadian rhythm is based upon melatonin levels within our brain. So melatonin is our sleep hormone. And when we wake up in the morning, we want a lot of light exposure. And that light exposure signals our brain to tell it to decrease the melatonin and basically tell us that we're awake and we're ready to get started for our day. Next slide. If you're not able to get sun exposure. Let's say you're working in an office or there's not a window by your desk, you can get a light box. And a light box is something you can find online. And you want something at the power of 10,000 lux, L-U-X. And what that provides is the same power of the sun as it's shining through a window. That way you get that same type of light exposure. You don't have to necessarily look at the light if you just need the exposure off to the side. So about 30 minutes in the morning is good. If you, once again, if it's just dark in the area where you're at, you can have it with you while you're getting ready. And then at the office, once again, just have it on the side while you're working. Next slide. Diet is also important, and we're going to hear a great lecture about that following this. But from my standpoint, in terms of eating, food is an important cue for circadian rhythm. In fact, for people who can't see and don't get exposure to light, people who are blind, I'll use eating times to help regulate their circadian rhythm. And and toward nighttime, probably the most important timing for food is dinner time. Dinner time can help set up the brain in terms of this anticipation of when you're supposed to go to sleep. So try to keep the timing of your food as regular as possible, but especially dinner time. Next slide. Exercise is also important as well. Exercise in the morning is, or during the day would be better, just because it helps increase your core body temperature. It gets you ready for the day. And with your core body temperature higher, it helps with metabolism. You don't want your core body temperature to be too high right before sleep. But if the only time that you can exercise is toward the evening, that's okay. Exercise, at least something, is better than nothing at all. Also, in terms of exercise, it's important to not just do aerobic exercise, but also to do some weight-bearing exercises as well, because that helps improve metabolism as well. Next slide. A little overview just as far as the way sleep is. It's divided up into different stages. And so we have our wake state. And then we, during the wake state, we build up chemicals in our brain. And this chemical is adenosine. And the adenosine is actually a neurotransmitter that makes us tired, makes us sleepy. And the only way to get rid of it is actually sleeping. So during slow wave sleep or non-REM sleep, it gets rid of adenosine. There's not really another mechanism or medication that gets rid of it. And then we get into REM sleep, and then we start the cycle all over again throughout the night, alternating between non-REM and REM. But the thing that I want to point out here is the buildup of adenosine throughout the day. Next slide. So I bring that up because adenosine is actually related to caffeine. So the way coffee or caffeine works is it blocks adenosine from activating the receptors within your brain. But here's the thing, is that it doesn't remove the adenosine. So the adenosine still builds up. So with the adenosine still building up, after the caffeine is metabolized, the adenosine can flood back in, and now you have this flood of adenosine coming back, which can make you sleepy. So that's why people might drink a cup of coffee, and then after that, they might get this crash and feel sleepy afterwards, which is why I always believe that you never really buy coffee, you just rent it. It doesn't really stay in your system and doesn't really do what you want it to do. Another thing about caffeine is it can last in your system quite a long time, about 12 to 14 hours. So even though you don't get the therapeutic benefits of caffeine, it can still be in your system, affecting your sleep at night. Next slide. So I mentioned earlier that adenosine builds up within our brain, and the only way to get rid of it is to sleep. So we actually need a certain level of adenosine at night in order to go to sleep. So there's this threshold that we have to reach. And by reaching that threshold, it's what we call homeostatic pressure, or sleep pressure, our brain knows it's time to go to sleep. We need that in combination with increased melatonin levels within our brain. So those two together are the signals the brain uses to help us sleep at night. Now, if you nap during the day, what happens is that by sleeping during the day, you actually get rid of some of that adenosine levels within your brain. So now when nighttime comes, you don't have enough adenosine and it becomes harder to sleep. So another way I like to put it is I like to think of sleep as food for the brain. So if you're imagining you want to eat this great buffet at night, at dinner time, it'd be better to not eat it all during the day. But if you're snacking throughout the day, you'd be less hungry. So same thing goes for sleep too. It's best to try to avoid napping, let the adenosine build so that the brain craves for sleep at nighttime. It makes it easier to sleep. Next slide. During the day, it's important to stay outside your bedroom. And what I mean by that is that you want to create your bedroom as an environment just solely for sleep. That way, when you go to sleep, your brain sees the bedroom as just for sleep itself. So it's important to not do any type of activity in your bedroom during the day. So no watching TV, no working, no hanging out in the bedroom. The only time you're going to go to your bedroom is just actually when you sleep. So what I recommend, what I tell my patients is actually during the day is to keep your door shut so you should never see your bedroom. That way, when it's nighttime and you're ready to go to bed, when your eyes see your bedroom, you create that association between sleep and your bedroom. It makes it easier to fall asleep. Next slide. It's important to develop a nighttime ritual also. And so I recommend a nighttime ritual 1 hour prior to bedtime. So going back to the analogy of food and sleep being food for the brain, I think of this nighttime ritual as kind of a commercial of right before dinner time, you're watching this great commercial of, let's say, this nice juicy hamburger, and it's 4 o'clock, it's not quite dinner time, and you get a little hungry, and you're like, I can't wait to go eat. Same thing for the brain. When you set up cues for the brain, such as dinner specific time, and then you have this nighttime ritual 1 hour prior to sleep, and you do some type of activity, whether it be meditation, reading a book, listening to a podcast, it could be stretching, massages, even just going for a walk. By doing that each time at nighttime, your brain learns that by doing these activities, you're preparing for sleep. And once again, it helps improve sleep onset. Next slide. Last thing you want to do is look at your phone right before sleep. So the reason being is, 1, it activates your brain. 2, with social media nowadays, it's hard to get off your phone and really put a time limit of when to stop. Next, it also, the light background, actually not just your phone, any type of screen. So whether it be a tablet, computer, TV, your phone, emits blue light. So blue light decreases the melatonin secretion from our brain. So we actually want our brain to start getting ready for sleep. So we want melatonin levels to rise, as I mentioned earlier. So the way melatonin rises is it gets cues of light dimming down. So a good way to think about it is blue light. Next slide. Blue light kind of reminds you of kind of the sky, the blue sky. So next slide. So here you got the blue sky on the left, which is you think, okay, the sun's going to come out. That's what your brain is thinking. And then on the right, it's more of this orange hue, which tells your brain, okay, I'm going to be getting ready for bed, which means that melatonin levels will be rising up. So another key tip is, next slide. When you do your nighttime activity, do it by an orange light. So you can have a desk lamp right by a chair or a sofa, and turn on that orange light, and that's where you can read a book, listen to an audiobook or podcast, or do your stretching exercises right by that orange light. and they'll start letting your brain secrete melatonin. Next slide. Another thing which you don't want to do is have a little nightcap right before sleep, such as alcohol. Next slide. What alcohol does is it actually, it makes you sleepy initially, but it actually decreases REM sleep. So if you look at this slide, the black line is the normal cycle of sleep, and the blue line is what happens when you drink alcohol. And you can see with the blue line, you don't quite reach REM. And then what happens is then the second half of the night, your brain has been deprived of REM. Think of REM as dessert for the brain for sleep. And it really craves dessert, it really wants REM. So it rebounds and it overshoots the REM. And that could actually cause disturbed sleep. Next slide. Another tip is to keep your bedroom cool. Actually, cooler temperatures helps activate slow wave sleep in non-REM sleep. So it makes it easier for your brain to fall asleep, which is why I brought up earlier, exercising during the day is better. That way your core body temperature is cooler at nighttime. Next slide. And as I mentioned also with light and dark, the circadian rhythm, getting blackout shades is helpful. That way in the morning, you don't see that light creep into your room and you could keep sleeping till it's time to get up. Next slide. In terms of getting up, it's important to know what time it is, but the best way to do it is to actually listen for the alarm. So this is a picture of an old school clock. Don't use your phone as a measure of time. Just set up the alarm on your phone. And we can set up multiple alarms on our phone. What I'd recommend is an alarm for dinner time, alarm for the nighttime ritual, an alarm for when you're supposed to go to bed, and an alarm for when you wake up. That way you really don't know what time it is. You're conditioning your brain of when you're supposed to be getting ready for bed, when you go to sleep, and when you wake up. Next slide. And so hopefully with these tips, you can feel great, looking like this little baby here. I wish to look like that. I admit that I don't look like that all the time when I wake up, even though I'm a sleep doctor, but that's my goal as well. Next slide. And so we have a sleep center here at Hoag. We several sleep disorders. We also have an insomnia class, which was mentioned in the beginning. If there's any questions, you could email there, sleepcenter@hoag.org, or give us a call. Thank you.
There we go. Thank you so much. I'm glad we really heard some awesome tips. And, you know, it's funny, I just had a baby and I feel like some of these tips are perfect because like these are the similar techniques that they teach you for kids, like the blackout blinds and have a nighttime routine. So it's funny because, you know, we do it for our kids and then we end up falling asleep at the same time. And I always wonder, I was like, God, I never used to go to sleep this early. What's going on? Obviously we're exhausted, but you know, all these things really do, I think, help. And I think especially the tip about the not using your phone and screen time right before bed. It's such a bad addiction, but checking all the emails and stuff. So thank you again. This was awesome. Really enjoyed those tips. And I hope those were helpful for our patients. So for anybody who has questions for Dr. Puangco, make sure you're putting them into the text box so we can answer all those questions. And then Leanne, I'm going to pass it on to you to give us some great tips on how we should change our diets to help foster all the great things for survivorship and risk reduction for cancer.
Thank you so much. Again, my name is Leanne Medrozian, and I'm a proud Hoag employee for the last 22 years. And on behalf of my partner, Tiffany, I'm very honored to be here today. Thank you so much to the amazing Dr. Khan for having me back. And thank you, Dr. Puangco. It was an honor to work with you, and that was an exceptional presentation. I think I'm going to go buy an orange light and try to stop drinking caffeine. Next slide, please. Great, thank you. Next slide. Today, I'd like to talk to you about healthy eating to support you through your cancer journey. So I'm going to touch on some different topics, of course, healthy diet, weight management issues. I'm going to talk about the role of phytonutrients in our diet, as well as exercise and a variety of current topics of interest. Next slide. So finding a healthy weight is an important part of survivorship. We know that excess body fat is strongly linked to an increased risk of recurrence as well as metastases. Studies show that up to 2/3 of women who are undergoing chemotherapy have unintentional weight gain. And the data suggests that reversing this trend is important in achieving positive breast cancer outcomes. So fat cells produce estrogen, as well as proteins that cause high insulin levels. These high insulin levels can actually promote tumor cell growth. Fat cells also produce pro-inflammatory cytokines, which can lead to chronic inflammation. This chronic inflammation we know has a direct link to increased cancer risk. Next slide, please. So some of the challenges in achieving a healthy weight include the hypometabolism that can come from undergoing a variety of different breast cancer treatments. This can induce negative hormone changes, including early menopause symptoms. Often women who are going through treatment, I know, just don't feel well. It's just hard to get up and be physically active. So this decrease in energy expenditure through physical activity, coupled with that decrease in metabolic rate, can really produce some unwanted weight gain. So I think it's important to find some eating patterns and diet-based strategies that can be set forth for a lifetime, and that can be sustainable in the long term. Next slide, please. So when it comes to finding a healthy weight, I want you to think about setting some small, achievable and realistic goals. I had a patient who was 200 pounds, and she came to me saying, well, I want to get back to my college bikini weight of 120 pounds in 6 months. That's not realistic. And I really think that kind of goal is going to be setting yourself up for feelings of failure. So it's important to kind of break down and chunk your goals into smaller baby steps. I encourage starting with a goal of 5 to 10% of your body weight over the course of 6 to 12 months. So if we use that example of 200 pounds, then your goal would be to lose 10 to 20 pounds over the next 6 to 12 months. This is what studies show actually improves your chance of keeping it off from less than 5% to greater than 95%. So it's really that slow incremental weight loss that produces the best sustainable outcome. I think it's important to make sure you don't put a lot of pressure on yourself. So you don't need to try to look like somebody else or lose weight like somebody else. You just need to find what you're comfortable with and kind of move forward in a very positive way. I also think it's very important to involve your entire circle. So letting your family, your friends, your coworkers know what your goals are. So for example, letting your husband know, okay, I don't want you to go to Costco and buy that giant bag of chips or a box of cookies because it's just too tempting for me. But rather, help me by buying, more fruits and vegetables so I can start to incorporate those healthier foods and move towards my goal of achieving a healthy weight. I think it's important to involve friends and coworkers. So, letting friends know. So, when you're going out, you can perhaps choose a little bit healthier restaurant, letting coworkers know. So we can take that, little 10-minute walk and maybe not Starbucks, but just around the building a few times. So I think that communication and involving everybody, I'm a big fan of using all the tools in the box. And I think that definitely includes the people that are important to you and come in contact with you on a regular basis. Next slide, please. All right, so the general guidelines for healthy eating, although there are many nutrients that demonstrate anti-cancer properties, there's no single food or nutrient that can prevent cancer or its recurrence. So in general, I recommend moving or shifting more towards a plant-based diet and following kind of that Mediterranean style eating pattern, which includes plenty of fruits and vegetables and a lot of fiber, primarily through things like beans, legumes, seeds, and whole grains. I would like you to include a small portion of a lean protein with every meal, including the plant-based proteins. So more chicken, turkey, and fish, less red and processed meats. I want you to start thinking about shifting to a little bit lower fat diet. We know that high fat diets can be linked with increased breast cancer risk. Definitely emphasizing the healthy fats, so our olive oil, avocado, nuts, seeds, and salmon. Processed foods really trigger that inflammatory process. So paying attention to limiting and really reducing the process, especially the ultra processed foods like snack foods in our diet, is an important step to fighting that inflammatory process. So minimizing our processed white grains, white rice, white potatoes, white breads, and processed sugars. We want to make sure and drink plenty of water, limiting the sugary beverages, sports drinks, and fruit juices. Of course, exercise is important. I'm a dietitian. I talk about food, but I'm also a firm believer in moving your body in a healthy way every day as an important part of achieving and maintaining a healthy weight. Next slide, please. Okay. So phytonutrients are these substances that I really want you to flood your body with. I want to coat your cells in this protective substance that is going to help stimulate your immune system and also protect yourself from carcinogens, things that are in our environment and our diet that can really damage DNA. So these phytonutrients are going to help stop that negative process. They can also help fight that inflammation because we know that chronic inflammation is correlated with tumor growth and metastases and reduced survival rates. So it's really the synergy of nutrients in whole foods that offer us the most protection from disease. This cannot be replaced by any pill or supplement. So these phytochemicals come from fruits and vegetables. So I want you to eat the rainbow, choose a variety of vegetables, a wide variety of colors, tastes, flavors, eat what you like, but also try new things so that you can start to incorporate more fruits and vegetables because these phytonutrients can actually slow the rate of cancer growth. Okay, that's an important concept I want you to walk away with today. Phytonutrients can slow the rate of tumor cell growth. So you've probably heard the national recommendation that all Americans should be eating 5 servings of fruits and or vegetables every day. Well, the research is very clear that for disease prevention, we should actually be eating 8 to 10 servings a day. That's a scary number, but all of you are not average Americans. You've already gone through scary times, so I know that you're well educated and you're more proactive and more receptive to hearing the facts that these higher numbers, these higher servings of fruits and vegetables are actually what we need to start incorporating into our daily eating pattern. So when I say 8 to 10, I don't mean you have to have 8 to 10 different kinds of fruits and vegetables. I'm talking about portion. So just some general guidelines as to what a portion is. For fruits, about the size of your fist or the size of a baseball, so apple, orange, pear. If it's a low water fruit like a banana, about half of a regular banana. If it's a high water fruit like melons or berries, it's about a cup. So about your hands together. Sorry, on video. There we go, about a cup. Okay, so if you're having steamed broccoli for dinner, like a cup of steamed broccoli, that's 2 servings. So it's not 2 different vegetables, but it's 2 portions. So that's where I'm getting the 8 to 10 different servings a day. Next slide, please. Okay, so I encourage the Mediterranean style of eating pattern because we know this can significantly reduce breast cancer risk. This style of eating is really based in daily fruits and vegetables, whole grains, herbs, spices, and the healthy fats. In moderation, choosing the lean animal proteins, also including the plant-based proteins, and then really minimizing things like alcohol, processed sugar, red meats, and processed meats. This is another very important take-home message. The research shows that including 1 to 2 cups of the dark green leafy vegetables every day can reduce your risk of breast cancer development as well as recurrence. So this is a big step, but thinking about including things like spinach, kale, broccoli, asparagus, Brussels sprouts on a daily basis. So this takes planning. This takes paying attention to, well, what do I have in my fridge? Okay, so the spinach and broccoli, they go bad first. So I need to eat those today. And then, tomorrow I can roast off the Brussels sprouts because they last a little bit longer. And then when I'm out of those, I can rely on my frozen asparagus and my frozen mixed greens to make my smoothie with. So, like I said, it does take some planning, but this is, again, it's a really important step in flooding our body with these healthy chemicals, and specifically in the dark green leafy vegetables, it's a substance they're called carotenoids. So these carotenoids can actually inhibit the growth of breast cancer cells, and I strongly encourage incorporating those into your daily eating pattern. Next slide, please. So the plate method, this is a simple visual guide as to what should be on our plate and what should our meal should consist of. I encourage that the bulk of your plate, so about 3/4 of your plate, come from plants in order to make sure that you get in a good dose of those anti-cancer phytonutrients. If your goal is to reduce calories and start to lose some weight, then you'll want to choose a smaller plate. So maybe the dinner plate is actually, or excuse me, the salad plate is actually your dinner plate. So it's the smaller, which is typically about a 5-inch plate. So using that as your guide, and then using the little saucer cup as a guide for your snacks. Next slide, please. Okay, so some overall healthy diet tips for prevention. Again, I want you to focus on eating lots and lots of fruits and vegetables with at least 2 cups of fruits and 3 cups of vegetables every day. Okay, I want you to exceed the standard American diet recommendation for fiber, aiming for greater than 30 grams of fiber per day through your whole grains, fruits and vegetables, and legumes. Choose a small portion of lean protein every meal, including those plant-based proteins such as beans, lentils, quinoa, oats, chickpeas, and yes, even a moderate amount of soy proteins such as edamame and tofu. Choose your healthy fats, so more salmon, avocado, olive oil, nuts, and seeds. And then focus on really reducing the processed foods and the refined white flours, grains, and sugars. I strongly encourage minimizing red meats and processed meats, and then eliminating or minimizing alcohol consumption. Next slide. So there certainly are a number of women going through breast cancer treatments that are underweight and need to gain weight. So in general, I encourage for this population to eat more small frequent meals to ensure we can get enough calories in. 3 meals is typically not enough. And my general rule of thumb is to eat or drink something with calories every 2 hours while you're awake. It's often helpful to choose liquid calories, such as juices, milk or milk substitutes, smoothies, soups, or protein drinks, whether they're homemade or commercially purchased. Choosing high calorie, high protein snacks, such as natural nuts or natural nut butter, such as almond butter, peanut butter, avocado, and in this case, definitely include something like cheeses. All of these liquid calories and high protein foods and high calorie foods are also helpful for those who have a real intolerance to volume. You just can't eat that much at one time. So choosing those more nutrient dense foods can enable you to get in enough calories throughout the day. I also like to cook with a little bit of extra olive oil. So while your family may not need this, you can prepare the meal and drizzle a little extra olive oil onto your salad or your soup or your vegetables, just to help you sneak in those few easy to digest calories. Next slide, please. So mindful eating, this is a topic that I could talk about all day long, but I'm going to try to condense it down into this one slide. So I want you to start by keeping those low nutrient value temptation foods out of the house. Make a shopping list and stick to it. Don't skip meals or snacks, which could cause you to be overhungry and then overindulge later. Always start your meals by eating a small portion. We're trained to fill our plate with food, but we don't often need that much. Our mind plays tricks on us, and we have habits from childhood. So start with the small portion and see how you feel. If you're still hungry, you can always go back for seconds. But when we fill our plate, our temptation is to finish it. So I want you to pay attention to why you're eating. Are you tired? Are you bored? Are you stressed? I think it's important to start getting in touch with why you're eating other than the fact that you're hungry. So if you're feeling kind of symptoms of loneliness or depression, then reach out to a friend or a family member. Just call someone on the phone. Often just that 5 minutes of diversion can allow you to make a different choice rather than allowing food to fill that void or kind of calm that feeling, you making that human connection. If you're feeling stressed or anxious, then I like to use the tool of going outside, opening the door, walking outside, even if it's just to take a little lap around the patio, or better yet, a lap around the block. I think giving yourself that 5 to 10 minutes outside can really alter your brain chemistry, as well as change your perspective. To just give yourself that moment, again, that moment of pause to make a different choice and move down a little bit more positive path. Be grateful about the food that you've made for yourself and appreciate the gift of a healthy meal. And this is important. To get back in touch with your natural appetite trigger, remember that you should stop eating when you're no longer hungry, which occurs far sooner than when you feel full. This is subtle, and it takes time to really reconnect our mind and our body to this sensation that we had as children, was kind of forced out of us as adults and lost. So, we don't need to feel like, oh, I'm full, it's time to unbutton my pants, it's time to stop eating. It's really just the lack of hunger. Like, you could eat more, but you don't really need to. So I think that sensation is a powerful tool in overcoming that mindless eating that really leads us down the wrong path. Next slide, please. So I do want to touch on exercise. Exercise is, I think, a very, very powerful tool to help combat the hypometabolism, or the slowdown of our metabolism that occurs typically in many breast cancer patients. Exercise helps to strengthen the immune system. It helps regulate hormone levels. I use exercise as a stress management tool. It really helps to kind of lower cortisol levels and help manage my anxiety. And I think it makes us feel stronger and more confident. I want you to include some cardio to strengthen your heart, as well as some strength training to help build and preserve that muscle mass. Schedule yourself in. Make exercise a daily commitment. Use whatever tools you need, as a Fitbit or an Apple Watch to help track your progress. It may mean joining a class or hiring a personal trainer. I think what tools you need to help keep you motivated and committed to moving your body in a healthy way every day. It doesn't matter what kind of shape you're in. Just start wherever you are and increase the time and intensity of your exercise slowly and within your physical capabilities. Next slide. So when it comes to exercise, make it simple, make it realistic, and make it fun. So whether it's walking the dog or playing Frisbee with your kids, taking online yoga class, joining a friend for a bike ride at the beach, we want to make it happen. So I I like to schedule it in. I put it in my calendar. Every day I have something. So whether it is meeting with a friend or taking an hour class, or perhaps it's just a 10-minute walk in the morning before I go to work, and then a 10-minute walk at my lunch break, and then a 10-minute walk when I get home. So I haven't spent an hour doing anything. I haven't disrupted my schedule, but I ended up with 30 minutes of activity. That's absolutely important and doable. Next slide. So I just want to touch on a few different topics of interest. In my years as an oncology dietitian, I frequently get asked, does sugar feed cancer? So for the purpose of this conversation, I'm going to define sugar as sucrose, so white processed sugar. So I'm not talking about glucose or fructose, which is the sugar in fruit naturally occurring. So glucose, not sucrose, feeds every cell in our body. It's also the fuel that feeds our brain. So even if you cut out all carbohydrates from your diet, your body is still going to make glucose from your immune system cells and your muscle mass, which can leave you malnourished. So while we know that there is no direct link between sugar intake and cancer risk, we do know that high sugar intake increases insulin levels. And these high insulin levels can promote tumor cell growth and signal the body to store fat. So in order to minimize this complication, I want you to focus on choosing less added sugar, less processed foods, and focus more on choosing those good high fiber complex carbohydrates. Eat your carbohydrates with a little bit of lean protein and healthy fat. This will help balance insulin levels. If you have a tendency towards high blood sugars, whether it's a history of diabetes or perhaps steroids along with your chemotherapy, then what I recommend is eating your protein and fat at your meal first, and then follow it with your carbohydrates at the end of the meal. Studies show pretty conclusively when you eat like this, you are going to decrease that insulin and glucose response by at least 30%. Next slide. So I'm just going to touch quickly on these different topics. The current evidence shows that the isoflavones in soy products is not harmful to breast cancer patients and may even show some benefit. What I do recommend for soy is choosing whole soy foods, such as edamame or soy milk versus powders or supplements. The ketogenic diet, of course, is very popular for weight loss. At this time, studies aren't showing any significant evidence of anti-tumor effect in breast cancer, but perhaps in the future we'll see. Intermittent fasting is heavily studied and shows, I think, a lot of promise in different areas. But for breast cancer patients, I don't think there's enough research to make any specific recommendations at this time. Organic foods don't have any strong evidence to show a lowered cancer risk, but by choosing by choosing organic foods more often, you're definitely going to be reducing your exposure to harmful chemicals, pesticides, and pollutants. So what I encourage my patients to do is, if possible, when you're choosing your fruits and vegetables, use the guides such as the Environmental Working Group's Dirty Dozen, which tells us the 12 most pesticide-heavy fruits and vegetables. So for example, things like cherries, apples, tomatoes, strawberries, they retain a lot of pesticide residue, so choosing organic where possible is a good idea. There are the lower fruits and vegetables, things like avocados, bananas, that don't retain a lot, so it's okay to buy them conventionally produced. Next slide. So what do I do? So in general, I first want to say that I don't eat a perfect diet. Nobody does. I don't expect that of anybody. But every day I try to follow a 90-10 rule. So 90% of the time, I eat 5 things. Vegetables, lots and lots of vegetables. I don't care if they're fresh or frozen, cooked or raw, soups, smoothies. Just make a point of choosing your vegetables first. So planning your meals around your vegetables. This is not how we were raised. It's meat and potatoes or chicken and rice, but the vegetables tend to be an afterthought. So make it the first thought. Number 2, fruits, whole fruits. So not dried or juices, fresh or frozen. I always have frozen blueberries in my freezer to make smoothies or add to my oatmeal. And let's see, number 3, my complex carbohydrates. So my whole grains, my oats, my legumes, my brown rice. So I can make sure that I'm getting plenty of good high fiber foods in there. And then my lean protein. So more chicken, turkey, and fish, less red meat. And then of course, the healthy fats are number 5. So more salmon, avocado, nuts, seeds, and olive oil. And then there's that 10%. So that's my fun food. So that's going to be things like red meat, bacon, sausage, things we may love traditionally or want to have on a special occasion. That's fine. Small portions once or twice a week, but it's not the basis of our diet. It's not that foundation of our healthy eating pattern. For me, it's sugar. I love sugar. I love chocolate. I think chocolate is essential to life, but I don't eat it every day. And when I do eat it, I try to eat the good stuff. Good, high quality, organic, dark chocolate, and I really, really enjoy it. I'm a big fan of batch cooking. I'm a dietitian. I love to cook, but I don't want to spend 3 hours in the kitchen every day. But I do make a point to spend 3 or 4 hours one day a week cooking a large batch of soup, like a vegetable soup or my red sauce or a big dish of enchiladas that I can eat today, have leftovers tomorrow, and then freeze. So during my busy week, I have some fast food that I can rely on. Make sure to drink plenty of water. And then, of course, as Dr. Puangco so eloquently explained to us, getting enough restorative sleep, I think, is really critical in helping us not only feel well, but be energized for our exercise and kind of have that strength of mind to make good food choices throughout our day. Of course, I'm an advocate of daily exercise and incorporating a lifestyle pattern that includes moving in a healthy way every day. Take pride in your body. Be patient with yourself. Respect what your body can do for you. It's a powerful thing. I'm so grateful to be here today. Thank you so much. And I look forward to answering any of your questions.
Leanne. You did a wonderful job and gave us some great tips and gave us some good reminders on healthy eating habits, which we all need to be doing. I've got some wonderful questions going. So let's go ahead and move into our question and answer session. Please continue to add any questions if you have anything last minute. I'm going to go ahead and start. So Dr. Puangco, I've got a few questions for you, so let me kind of go back and forth. But the first question is, how many hours of sleep should I be getting every night?
So this is a pretty popular question. It really varies from person to person. They did actually a analysis over multiple studies to see what the best time is. And there's really not a time per se, but it's more of a range. What we look for is between 6 to 11 hours. And what that means is anything under 6 hours or over 11 hours is associated with increased cardiovascular disease. So anything in between there. If you wanted a sweet spot, it's about 7 to 8 hours of sleep. But once again, it's really what you feel your body needs. And I think that's an important point because for example, I had a patient who came to me for insomnia, and he said he couldn't sleep, and he said he slept about 7 hours a night, and which was fine. I asked how he was during the day. He said totally functional, productive, no issues. And I asked him why he felt he wasn't sleeping enough, and he said it's because his wife slept 9 hours, and so he felt compelled to sleep the same amount of hours as her. And from a social aspect, he wanted to be on the same time schedule also. But I had to highlight to him that it's really all different. And it's really what you need for yourself.
Great, thank you. The next question I have for you is, a patient mentions that they take over-the-counter melatonin and they're worried about being addicted to it. So how would you comment on that or make recommendations?
Yeah, so melatonin is a very common over-the-counter drug to take, and because it's just so accessible. So our brain produces about 44 micrograms of melatonin per day. So that's all we need. So if you think about it, the lowest pill that you can buy out there is a 1 milligram pill. So that's 1,000 micrograms. So if you're taking a 1 milligram pill out there, you're taking more than double of what your brain actually needs. So we actually don't need melatonin because our brain produces it. In fact, if we start taking things that our body doesn't need, it stops producing it. So it's actually better. The better question is, do you need melatonin? And the answer is usually not. The best use of melatonin is really for time zone changes. So if you're traveling, say from East Coast to West Coast, vice versa, you can use melatonin to help entrain your circadian rhythm, but you really don't need melatonin to help you sleep because your brain can do that all by itself.
Great, thank you. So Leanne, I have a few questions for you. Somebody asked about emotional eating and how they might be able to break the cycle of emotional eating.
So that's an excellent question, and I will try to give you a short response because it's not very simple. I think the first step that I would suggest is to keep a journal. So paying attention to when you're eating, what you're eating, but more importantly, why you're eating. What are the emotions behind it? When we eat to calm ourselves or fill a void, we tend to choose foods that are high in fat and high in sugar and give us that immediate satisfaction. And then that leads to feelings of guilt because we overindulged in something that we know is not good for us. And that just creates this negative pattern and reinforces that guilt. Honestly, I think guilt is kind of a useless emotion. It just can kind of give us a free rein to do what we want. So, just be kind with yourself and be patient. Like I said, no one eats a perfect diet, but starting to identify why you're eating and creating new habits. So, like I said, I'm a big fan of using all the tools in the box. So if you find yourself eating for other reasons than being hungry, start to come up with a list. What can I do? So a common thing I have heard, especially over the last couple of years, is I'm bored and I'm lonely. So what do? That's when we use our phone a friend and we start to reach out and make those connections, whether it's just on the phone or Zoom or walking our dog in the dog park and just seeing other human beings and saying hello, and taking that, those few moments to change our perspective so that we can make a healthy choice versus just filling ourselves with foods that are not going to be good for us in the long run.
Great answer. Thank you so much. Another question I have for you is, do you have any tips for breaking a sugar addiction? You might have some because you mentioned that sweets are your thing.
I have a sweet tooth. That is for sure. And it's always kind of, gnawing at me back here. So I think one of the most important things is to make sure you don't skip meals so you don't get hungry. When you're hungry, your glucose levels fall, right? And that triggers our brain to eat. So it's time to eat. And that's a very powerful chemical reaction. And given the opportunity, we're going to open the fridge and we're going to grab the first thing we see. And if the first thing we see is a donut or a cupcake, that's what we're going to eat. We don't really have that kind of brain power to make that good choice. So eating on a schedule, making sure that your meals and snacks are high in fiber to help regulate our glucose levels, some protein to keep our glucose levels in check, and then preventing that hunger from kicking in. So when it's time to eat, we eat our food and we don't have as many cravings for sugar. And I think Dr. Puangco touched on it very well. Like when we create a habit, a negative pattern, like looking at our phone before we go to sleep, it's the same with food. The more sugar we eat, the more sugar we want. With that, or like with caffeine, it brings us up and then it brings us down. Same thing with sugar. So keeping it out of the house, using fruits and vegetables. I always say if you have this desire to go eat a cookie, you have enough energy to go eat an apple. Okay. Eat that apple. Okay. If you can eat that apple and satisfy that hunger, maybe, 7 out of 10 times you won't go back and eat that cookie. But if you do, it's not the end of the world. But we really want to try to minimize it and fill our household and our eating pattern with those healthy food choices instead.
Great. So I know we're getting close to wrapping up, but I do have so many questions. So I'm going to try to get through as many as I can. Dr. Puangco, I have another question for you. Somebody mentioned that they don't remember dreaming unless they've overslept. And they're wondering if having dreams is part of normal restful sleep.
Actually, that's a misconception. You don't have to really remember your dreams to have a restful sleep, because it really depends what stage of sleep you wake up from. And so there tends to be more REM toward the end of the night. So it's not uncommon that you wake up with dreams, but just because you have it or you don't have it really won't say anything about the quality of your sleep.
Got it. Great. So I have one more question for you. Do you have any recommendations about whether any sleep disorders could increase risk for breast cancer or are related to breast cancer?
Yeah, thanks for bringing that up. Actually, one topic which I didn't bring up is sleep apnea. So sleep apnea has been shown to, it's basically a lack of breathing throughout the night, so lack of oxygen. And as it goes down, it can cause inflammation to the body, to the airways, to the heart. And that inflammation can increase cancer risk. So treating sleep apnea would be important, one, to decrease cancer risk, and two, to also help improve your response to cancer treatment, because by improving your sleep, that helps with how your body responds to decreasing inflammation.
Great. Yeah, that's something I don't think I was even aware of that. So thank you for that tip. I can't see Leanne's video, so I think we might be having a few technical difficulties. But I know it's time to kind of end the night. So hopefully Leanne will pop back in. She did a wonderful talk, and we really appreciated having her. But thank you, Dr. Puangco, for all of your tips on sleep. And hopefully, I know this has been a topic of interest for many survivors. And just for everybody that's joining us, there we go. It looks like Leanne's popping back on. For all of you who are joining us, just remember you will, if you registered, get an email notification for our newsletter, which will have some topics and a small talk from both Leanne and Dr. Puangco on some of the tips that they gave you tonight, as well as a link to a survey. So please take the couple minutes it takes. It's just a few questions to give us some feedback about our event tonight. Leanne, I am glad that you popped back in. I just have one last question before, I know we had a long night, but I just wanted to make sure we got this question in.
Okay.
So the question is about probiotics and how that helps our health. And then, I don't know if we're going to have time to get to all the other questions, but can you go over that question for us before we say goodbye?
I think probiotics are great for gut health and immune health. But if you are neutropenic or your cell counts are down because of chemotherapy, then I would certainly defer that to your oncologist.
Right. Okay. Since it was a short and sweet answer, I'm going to ask one more thing, because this comes up all the time for breast cancer patients. What about natural herbs or things like turmeric preventing breast cancer, etc., things that are in that kind of realm?
I wish there was one herb that could prevent breast cancer and we were all out of a job. So in terms of herbs, I evaluate that individually based on the medications you're taking and any potential interaction risk. I discourage mega dosing or using anything as a replacement for medications, and making sure that your oncologist knows everything that you're taking.
Great. Awesome. Okay. Thank you both again for your wonderful talks. And for any of the questions where we weren't able to answer, hopefully there'll be opportunities in our upcoming events, or please reach out to the individuals that are part of our talks. And please take the time to fill out the newsletter or to read your newsletter and to fill out the survey, and mark October 19th on your calendar for our next event. Thank you both. Have a good night.
Thank you, Dr. Khan.
Thank you.